Hi, I'm Dr. Linda Nguyen from Stanford University. Today I'll be talking about preparing for your appointment, going beyond symptoms to address your goals. Because the reality of it is your goals are more important than any individual symptom. So first you want to start by researching your doctor. The patient-physician relationship is like dating. You want to find an individual who is your match, whether it's an expertise, approach, availability, personality. All of this information you can garner with an internet search, whether it's reviews, bios, social media. As with all reviews, you have to take everything with a grain of salt because different individuals have different personalities that don't match. So just like in dating, someone you date may not be perfect for you, but may be right for somebody else. The years of experience does not necessarily equal the best doctor for you. The most experienced or well-published physician may not have the access or availability that you need. So think through what it is you want in a physician. And again, just a quick Google search of myself, you can see that there is information about me out there. And the key to finding the right physician is to build a mutually trusting relationship. When you meet your new physician, understand that past experiences influence all of us, whether it's good or bad. Do acknowledge the bad experiences and discuss how to avoid replicating, but don't rehash the experience and, quote, talk bad about other doctors. In general, talking bad about other individuals makes us uncomfortable, but do talk about how prior experiences impact your decisions today. And I love this quote by Michelle Obama is, do not die in the history of your past hurts and past experiences, but live in the now and future of your destiny. And most importantly is trying to align your goals. In order to align your goals, you need to understand what your goals are. And it helps to write this down before coming into the appointment. Is your goal to find a cure, to improve your symptoms, improve your quality of life, understand the cause of your symptoms? Is there a diagnosis that you think you have that you want to discuss? Is it about your future? What does the future hold? State your goals early. Don't wait until the end of the appointment. I can't tell you how many times I've met with patients where we have a long discussion about everything, and then the goals I'm made aware of the goals at the very end of the appointment, which is very difficult to address in those last final minutes. Once you've determined what your goals are, it's important to prioritize them. Oftentimes there are multiple goals, but they can't be achieved all at once. And in going back to aligning the goals, especially in chronic illnesses where a goal may not be possible, what are your other goals? And you need to prioritize these based on urgency and importance. And this is a matrix that I've adopted in terms of decision makings for projects, anything that you want to address or attack is look at urgent and important. Is something urgent and important, important but non-urgent? Things that are urgent to you or to your physician may be considered medically necessary, and those must be addressed first as a top priority because of safety. The goal is to address all those urgent, medically necessary issues quickly so that you can get to the non-urgent but important issues. The key here is to have more goals and issues in the green zone that can be achieved over time than trying to take care or fix things on an urgent basis. And if it's not urgent, not important, that's something to defer until all the other goals are achieved. And then there's a negotiation. Your goals and your physician's goals may not be aligned, but negotiation really does not mean sacrificing your needs. It's trying to mutually understand the why. Why does your clinician want to order a test? Why is the treatment necessary? Why do you want to do a test or start a therapy? Why are you requesting a test? So it's the mutual understanding of the why. And if there are deal breakers, discuss those early. Negotiate with a trust that your clinician has good intentions. And really, the goal of negotiation is a win-win for all. And sometimes that negotiation requires accepting ambiguity. And why is that? Because medicine is a combination of art and science. And that's because humans do not fit into boxes. And when you look at definitions or clinical diagnoses, there are often check boxes that individuals do not always fall into. So we don't always have the right diagnosis or the right tools for diagnosis at this time. As such, modern medicine does not always have the answers, and diagnoses or conditions evolve over time. Accepting this ambiguity does not mean giving up. Accepting means taking charge. Oftentimes, the goal for chronic illness should be living and obtaining the tools to control the illness and live your life so that it does not control you. And that's really what I try to give my patients is what are the tools? What do they need to live their life and control their symptoms? So with that, I ask, what's your definition of living and what tools do you need? And these are the things that I recommend discussing with your medical team. Thank you.